I'm Dr. Blake Weidaw, and I'm an OB-GYN physician here at the Vitae Clinic in Austin. I've been here for approximately 5 years now, and I went to medical school up at Northeastern Ohio University's College of Medicine, and then I did my training and residency at the University of Texas Health Science Center in San Antonio. We see when the patient comes in as early as 4.5 weeks, we can see something inside the uterus that's growing. It's too small to be able to see the baby inside there yet, but we know that there is. And then by 5 weeks, we can see the baby itself. And by late 5 weeks, early 6 weeks, we start to see a heartbeat on the baby at that point. And as we follow the mother along as early as 7 weeks, we can see the baby moving inside there. And then honestly, by 10 weeks, it starts to look like a baby. You can see head, belly, little arms and legs moving around in there. So by 12 weeks, the organs are fully formed. So patients are always amazed when they come in at the early 7-week and they see a little tiny little white baby in there that's a little smudge. And then by 12 weeks, they come back a month later and they see a full baby moving around, arms and legs. And they are always so excited to see the change and the fact that, you know, from very early on, it does look like a little baby in there. Let's say we're watching the growth of the baby. You know, if for some reason the baby's not growing as well, or if there's something that looks like the baby's health is separately jeopardized, then we may deliver the baby based on just solely the baby's condition. You know, just like if somebody was sick, you'd admit them to the hospital. We see it the same way. If the baby's sick and not doing well inside the mother, then it is, you know, a separate consideration outside of the mom. The mom can be healthy and having a healthy pregnancy, but if it looks like something's wrong with the baby, then we make decisions based solely on the baby's health as well. You know, twins is obviously a special condition in pregnancy for us, and even the two separate twins are their own unique individuals in there. And when sometimes the twins will share a placenta during the pregnancy and the blood flow to one twin is more than the other twin. And so one twin's growing more and the other one's losing weight in there. And that's something we take very seriously very early in pregnancy. I mean, this is usually before they even hit what people consider viability, which is 23 to 24 weeks where the baby would survive outside there. Surgeries are done in utero to try and help the smaller baby that's not growing well to get a better blood flow. It seems pretty straightforward in medical school. You know, the earliest of our training, we learned that when the egg and the sperm come together, that it's separate DNA and it creates its own unique identity. So the conception does begin at the beginning when the sperm and the egg meet together, and it's its own DNA, its own separate being. And from that point forward during the pregnancy, as we take care of the mother, it's a separate person. It's a separate patient for us. We do testing on the baby just like we do testing on the mother. So, you know, the baby is its own person inside there, and throughout all of the pregnancy, you know, it's kept together but separate. You know, the baby is its own person inside the mother. There's no denying that life begins at conception. I mean, you can ask every medical professional who's gone through medical school, not just as an OB-GYN who deals with this every day, but it is taught, and when you learn how conception takes place, you know that that is a separate human being that is conceived at the time that the egg and sperm come together. So every medical professional is taught those same facts. So it's not anything that's disputed in the medical community by any means.